Okay, so my name is Julie Cotillo, as you know, and I will be doing a presentation, or really more of a discussion, on the pros and cons to cognitive assessment in the times of COVID-19. And I apologize, I'm not going to present this slideshow because I do want to see my notes down here. So I'm just going to click through. So first, should we be testing at all? And my first thought is, well, let's go to the trusted Massachusetts Department of Education. And if you look on their website, there's really no specific guidelines as to what you should be doing for IEPs, assessments, academic, cognitive, any of that. So legally, the timelines are still in place. There's no guidance, and the schools still have to follow these legal guidelines. Do I think a school is going to be reprimanded if they don't at this time? I don't think so, but that's a choice that each school district is left to kind of fend for themselves to answer. And there's no clear answer as to like how telehealth assessment would go as well. So there's just real no guidance. Towns are left to fend for themselves, and that makes me feel like towns should be testing because they can't get in trouble. School districts can get in trouble for not following special education law. So there's an argument for cognitive assessment in the times of COVID. But ethically, should we be testing? Well, during high stress times, trauma, for example, a pandemic, executive functioning and cognitive skills can easily become impaired. And some might say that that's not an accurate representation of the child because their executive functioning and cognitive functioning is impaired. But if the child's suffering, if their executive functioning is suffering, then we should meet the child where they are at the moment. If, let's say, a skill like working memory or fluid reasoning is impaired, we should assess them. We should assess their cognition so we can meet them where they're at, and we can adapt their IEP or qualify them for services so we can support them during this time. And we don't know how long this would last. Could it last a year, 2 years? We don't know. I hope not. But if that's the case, that's a lot of time to be going on an IEP going off of an IEP that does not account for the changes in the environment that COVID brings. Now, we talked about this in seminar. I'm not saying just give them the whisk and call it a day. I'm saying cross-battery assessment to really look at what the child is struggling with. But that's still cognitive assessment. As far as academic assessment, that's a whole nother ballgame because that is testing skills that should have been learned from March to June that weren't. So academic is way more complicated, but for cognitive sake, we want to support the child's executive functioning. But of course, there's arguments to say, let's not test. We don't have any results that are normed under this circumstance. Whether you're testing virtually, testing in person in a pandemic with masks and PPE, there's no norms. If you are doing virtual testing, the training for virtual testing is rushed, done virtually, very expensive. So it's a lot to ask districts to pay for. Well, they have to pay for a whole bunch of PPE. It's a lot to ask. And online assessments require a proctor to be in the room with the child, which would defeat the purpose of online assessments unless it's a family member that they live with, in which case that's a conflict of interest. So having the proctor is going to be a huge bogey where this doesn't work. So in this case, I'm saying no, we should not be assessing at all. And there's still more. Let's not. Continued. Are the behaviors observed in a pandemic at home, virtually, going to generalize to a traditional school setting eventually? Like I said, we don't know how long this is going to last. It might only be a few months. They might come out with a vaccine in 1 month, and then by the end of the school year, we're back to normal. Are we really going to put the child through all of those assessments if their skills aren't applicable to a general education setting that I hope we get back to one day? Another argument could be, well, IQs are stagnant. Cognitive skills can be tested because they're not going to change in a pandemic. But in reality, we all know that assessing cognitive skills using a test like the WISC tests their academic skills. It might not look like it, but it does. And another argument is COVID numbers are down right now, but that might be because schools are closed. So do we want to risk a spike or risk a child getting the virus when so many kids live with high risk people, or maybe they are high risk? It just seems like a lot to go through just so we can test a kid. And a caveat that we also talked about in seminar was that if we are testing kids, they really have to be held to benchmarks based on where they were the previous year in March. So if you're testing a 6th grader right now, you have to compare the results to a 5th grader in March. So you can't be comparing them to a 6th grader. That's not fair. Their academics stopped in March of last year, of this past March. And it would be unfair to compare them to their 6th grade, where they should be now if that had not been a pandemic. Is it safe to test? If it's low risk, we should open up with restrictions. That is what the CDC has said. And Massachusetts is considered low risk. The test positivity rate is extremely low. So given these recommendations by the CDC and looking at Massachusetts where they're at, we should try to open with precautions. That means wearing, having plexiglass partitions, socially distancing, wiping things down aggressively, and wearing a mask. So this would be an argument for testing. It says we're safe to open. We gotta try to get back to some sort of normalcy. And if it's not safe, well, why can't we assess virtually? I know we talked about why we couldn't assess virtually, but here are some arguments for assessing virtually. Wright did a interesting study. It was only one study, compared the results of the RIAS virtually and in person, and the mean scores and effect sizes did not between the in-person group and the virtual group were not statistically significant. So there was the difference between these groups were not statistically significant. So that's just one example of how remote testing is possible. Are we ready? We still have a long ways to go, but this is one piece of evidence saying we could if we had to. This is a very complicated topic, and I kind of went down a rabbit hole, and we talked about it in seminar, and I felt like I was doing this presentation in seminar the day before I was recording this. I don't think there's a right or wrong answer. I really, really, really see both sides. And it's hard to have an opinion on this. I'm uncomfortable, and you had said that's good. I'm confused. That's good. I feel like I have a good grip on both sides. I know the dangers. I know the positives to it. I think as long as we're going into it thinking, what has this child been through? We're not trying to just label them, slap them with a label. We're really just trying to support the child where they're at. I think as long as we go into assessment with that goal in mind, then we're not going to hurt the child, except maybe putting them through some tests. So I don't have an answer, but this is the information that I found. I found it very interesting. I guess that's it. Thank you very much.